What vein is identified by the pink arrow? This is the small saphenous vein. Our case here is abnormal in that the small saphenous vein is very dilated. Compare to the normal contralateral side. The small saphenous vein forms part of the superficial venous drainage of the lower limb. The preferred term is small saphenous vein over other terms such as lesser saphenous, short saphenous, or external saphenous veins. The origin is where the dorsal vein from the fifth digit, which is the smallest toe, merges with the dorsal venous arch of the foot. It is a superficial vein, being subcutaneous. From its origin, it courses around the lateral aspect of the foot and runs along the posterior aspect of the leg with the sterile nerve, where it passes between the heads of the gastrocnemius muscle and is directed superiorly in the subcutaneous tissue of the calf, perforating the deep fascia. Lastly, it drains into the popliteal vein. Tributaries include communicating branches with the great saphenous vein, cutaneous venous tributaries, and perforating veins communicating with the deep venous system. It is often accompanied by the sterile nerve, a branch of the tibial nerve. Here are some illustrations showing the course and gerontome of the sterile nerve. Variant anatomy includes the small saphenous joining the common gastrocnemius vein before draining into the popliteal vein. The small saphenous may also not contact with the popliteal vein, but drain into the great saphenous vein instead. And lastly, the small saphenous may merge with the Giacomini vein, draining in the great saphenous vein at the superior third of the thigh. We made a prior video on this. Clinically, varicosities may involve the small saphenous vein in chronic venous insufficiency. This vein may also be harvested for transplant to elsewhere in the body, such as coronary artery bypass. This is an ultrasound example of a reflexive small saphenous vein. Longitudinal view through the popliteal fossa and proximal calf shows a grossly dilated small saphenous vein at its junction with the popliteal vein. Transverse view also shows an enlarged caliber of an incompetent small saphenous vein. You now know a ton about the small saphenous vein. Please subscribe for more awesome anatomy and radiology videos.